A constant battle in the U.S. healthcare system is the fight between insurers and providers over the cost of medical procedures and who foots the bill. Both sides are turning to artificial intelligence to make their case. New data from early-stage venture capital firm Menlo Ventures finds U.S. health insurers and hospitals spent $1.4 billion on AI last year in the fight over medical bills. That's triple what was spent in 2024. United Health Group says it plans to spend $1.5 billion on AI in 2026, expecting to save nearly $1 billion this year. HCA Healthcare, the country's largest publicly traded hospital chain, says it expects to save $400 million this year using AI cost-saving initiatives. But lawsuits from patients claim insurance companies are using the tech to wrongfully deny coverage for essential services. Dr. Céline Gounder joins us now. She is a CBS News medical contributor and editor-at-large for public health at KFF Health News. So, first off, how are hospitals and health insurance companies using AI?
Most of this is in terms of administrative tasks, things like billing and claims in particular. So we're seeing the hospital AIs trying to maximize billing and charges, and then you have the health insurance company AIs trying to minimize what they're going to pay out and denying claims. So it's sort of AI competing AIs, dueling it out together.
And so how does that help or hurt the patient?
Well, it means that claims may be processed more quickly, but they may also be denied more quickly. And one of the things we know from Medicare Advantage, which is basically the HMO version of Medicare, is that 80% of claims that are denied go on to be approved, which indicates that it's not a question of medical need. It's really a question of documentation. Was the adequate documentation provided, or was it in the medical chart? But the problem with this is this could result in delays in care if the system gets more efficient at denying claims, even if it's not medically indicated.
So 80% of the claims that are denied do end up being approved?
For Medicare Advantage.
Wow. Okay. So what should people know about how this AI is used before they seek treatment or before they, I guess, apply for reimbursement or fight their claim?
Right. Well, I think the key is to understand that AI is mostly in healthcare right now being used for billing and administrative tasks. So it's not replacing your doctor yet. Where we are seeing it being used in medicine more directly is things like radiology. So, for example, a mammogram might be reviewed by both AI as well as a radiologist. Pathology, say from a biopsy, may be reviewed by both an AI and a pathologist. So we are starting to see it creep into certain very specific fields like that.
Are there any ways for patients to advocate for themselves?
Well, so first of all, there are AI, consumer-facing AI tools that can help you sort out. In fact, it just adds another AI dueling in the mix.
Great, three AIs.
An AI that can help you review a bill, that can help you explain what different charges mean, that might also help you draft an appeal letter if you've been denied coverage. But at the end of the day, you may still need to speak to a billing expert or a patient advocate, or get help from your doctor's office. And you should feel like you have those options available to you. AI is not necessarily the final answer.
I mean, it feels somewhat dystopian, though, the idea that no one person is looking at your claim, no one person is looking at what you've been through, and you're just reduced to this algorithm. I mean, is that what patients are telling you that they're experiencing, or are some people saying it removes any subjectivity?
Well, there is, so where I get involved is a health insurance company might deny a claim, and then I get contacted by our hospital administration who will say, Dr. Gounder, can you get on the phone with somebody from the insurance company, where we then end up having a conversation. But I am seeing more of those kinds of interactions needing to happen because they are denying even more.
All right, Dr. Céline Gounder, thank you.